I think it's important, and I keep saying this, that we reach out more than ever to people. Um, and I think a lot of people don't even realize they're depressed. They may have not been depressed before, but they're just sad, or they don't understand why they physically feel the way they feel. So I think if someone's feeling a little different, if they're tired all the time, or they're having stomach problems, or headaches, it's probably a good idea to see your doctor. Give a call, because um, it's important. And it's important that we reach out to each other. If you see their neighbors, young people, or elderly especially, call them on the phone, talk to them. I just think it's important we reach out to people. The one thing that we're noticing is the lack of the 12-step groups. And right now, the smaller groups are meeting. We're encouraging people to maybe meet at the park, or meeting for coffee outside of an outside restaurant, a few people. But I know, especially people that are new to recovery, they really need that support. And there's Zoom meetings and there's all that going on, but they need the fellowship. And we've been working close with places like Neil Kennedy, and she's working on that. And we're doing the best we can to try to open this up, but we're looking for guidance from the governor's office. And once it's safe to do that, they're going to do that. And telehealth has been a great game changer, because almost anyone can do it now. And so they can call on the phone, they can talk to their doctor. And I just think it's real important. I think that the use of social media, you see more and more support groups meeting through Zoom and meeting through different places. I think we're doing the best we can. The text line is outstanding. I mean, we have the hotline, we have the Warmline. I think the text line is a way people, especially young people, can communicate without totally exposing themselves. I mean, I worked at the hotline for 24 years, and the moment you pick up the phone, just the way the person responds at their end, when they take that deep breath and they make their first statement, it's somebody deeply in distress that has a difficult time asking for help. I think the text line kind of breaks that barrier down a little bit, and you can just, text. The thing with the Warmline, was started several years ago at Help Network, and what we found was the crisis line was exactly that. It's for people calling for a crisis to deal with, or a quick information referral. But we found there were a lot of people who just had the need to talk and to express concerns and anxiety. And the Warmline is a perfect situation for that. It's run by peers, people with life experiences. So you're not going to get the same response that you get from the hotline, but you're going to get a friendly listening ear that's been there, that knows exactly what you're going through, because they've been through it before, and it's okay. We also started a Hero Helpline. And it's through Compass Family Services, and they're working with the Mahoning County and the Trumbull County Mental Health and Recovery Boards, and that's a place for first responders to call, or first responders' families to call, because many of these first responders, and right now especially, it's kind of easing up. When you're in the midst of a crisis and your adrenaline's going, and you're doing what you're doing, and you're doing what first responders do best, but save lives. You're in the midst of it. But as things start to slow down a little bit, and you got time to think, and you may have been the last person with someone who was losing their life, and their family can't be with them, and you're the one they're holding their hand, you're going to need someone to help you. Because with stress, if you don't deal with it right now, it's going to come back and get you later. And we don't want that to happen to our warriors. We want them to get help. So the Hero line is just a number to call and say, hey, I really had a rough day. I got to go home, and just to kind of debrief. And so we put that in place, and it's for the hospitals. We've had a few nursing homes call and ask if they could utilize it. But I feel the same way. If someone's working at Walmart and they're every day working hard to feed their families, and they have to go home at night and they just want to talk on the phone and decompress, call that number. I think it's wonderful. That's what we got to do.
For over a century, Farmers National Bank has stood strong. Through booms and busts, peaks and valleys, we've learned to know the seasons and how to grow in each of them. During challenging times, everyone is reminded of the value of solid relationships in both life and business. Farmers, stand strong.